So the work of the Human Trafficking Response Program aligns with CommonSpirit's collective commitment to health justice for all. We all have the right to health and safety. Abuse, neglect, and violence, including human trafficking, can show up anywhere at our healthcare facilities. So we view issues like violence and human trafficking as public health issues.
Because we know human trafficking victims do seek care.
And we have the opportunity to identify those who are at risk of experiencing all of these various social issues, to educate our patients on the resources in the community.
I had a patient, she came in as a triage patient several times. It was noticed that something was off.
I think health professionals have a really unique opportunity to identify people who may be going through a really difficult situation and may not feel comfortable expressing their needs to anyone else.
CommonSpirit Health implemented a system-wide abuse, neglect, and violence policy, which applies to all CommonSpirit facilities across the United States. One component of the policy and facilities procedures is the PEARR tool.
The PEARR tool is a recommended framework to guide health professionals in their interactions with patients who may be experiencing abuse, neglect, or violence, including human trafficking. And we encourage utilizing this tool in environments that are trauma-informed and in environments that can view social problems through a cultural humility lens.
P is privacy, which is so important that we allow patients to feel safe and that we can ask those questions we need to ask that can be pretty sensitive.
In the ER, it's very chaotic, it's open. I often have had to move patients into a private room.
To make sure we're getting an accurate answer from them and not an answer that is skewed from anybody in the room. So we really have to be creative in how we provide that privacy.
E is for educate. We want to educate our patients and have normalizing conversations about abuse, neglect, or violence.
Offering things like brochures or cue cards can give you an opportunity as a discussion to make sure that patients understand that violence is pretty common in our society.
We want these conversations to be normalizing so that no one feels stigmatized when they're speaking to any of our staff.
To ease patients' minds to make sure that they understand that I'm here for you and on your behalf.
To ensure that they understand that there are resources for them.
So A is for ask. If you're in a situation where you feel that the patient is comfortable to have further conversation, then you could ask if there are any concerns that they have that you could assist them with.
I see, Sarah, that you have several bruises. I see that you've been here 7 times in the last 2 months for similar injuries. Is there something that you would like to tell me? And then you have to give time to let them respond.
This is a time for us to talk about what's going on with you medically and also what's going on at home. Do you feel safe at home?
Okay, you're not comfortable sharing with me today, that's okay. But if anything changes and you want me to come back, you want to speak with me, I will definitely come back later today.
And so when you talk to patients, you really have to pull back the layers of what's going on.
So R is for respect. We want to ensure that what we do, the interactions that we have with a patient, empowers them to make decisions for their own lives.
Sometimes it's very hard because you think that maybe they don't know what's best for them at that point, but you don't know all the inner workings of that scenario.
There are many extenuating circumstances. It might be because of worrying about being deported. It might be worrying about any violence or issues that might occur with that person that they are with.
We all want to protect our patients. That's why we are in this field.
We have to respect their boundaries and respect what they think is best for themselves at this time.
So the last R is respond. However a patient wants to move forward, we continue to provide services, whether that's further healthcare needs or referrals to the community resources.
That's where it's really important that we partner up in the community to know how to respond.
If I have to call an advocate with human trafficking. If I have to find a shelter, a safe place for them to go.
So when looking at the PEARR tool, you'll notice that on the third page, you're able to populate community resources that are available to you in your area. Having this list and having ongoing relationships with these community partners are essential to ensuring that patients have resources long after they leave our hospitals. We want to ensure that our resources that are in the community will be able to respond to various cultural backgrounds.
Look for those partners who work with us to ensure that if this patient does want help, that we are able to facilitate that and get them to the right place.
So with the PEARR tool, with educating our staff, educating healthcare, we're able to be better prepared for these various situations that arise.
I had a patient, she came back the third time. She was in active labor, she delivered, and while her person was out of the hospital, she said, "I don't want to stay there, I'm not safe. He's gone right now, but I can't go on like this." And she did not have to go back to her situation.
Educate on the PEARR tool everywhere that we see patients, that we see people, and that gives us the opportunity to actually try to intervene and help them on their journey to getting some help.
Respect, dignity, human kindness are all things that can be used to engage in your patients on a day-to-day basis to allow them to open up and trust you in the care that you give.